the health, what does our health look like really in the Black and brown communities? When I started to think about this whole scenario, I'm actually gonna stop sharing for a second. When I started to think about this whole scenario, I recognized that health for us looks different. And it's coming in alignment with something that you both said. Like we have, for Black, in my judgment, for Black and brown communities, we have health concerns that impact us and that have impacted us for generations. And the thing that I've seen as being a health professional, I've been a trainer for 20 plus years, yoga instructor for 10 years. Also, I'm a person that has higher blood pressure, family has a history of cancer, kidney disorders. So for me, I had to start looking at what health can look like for me, because it's going to look different than white souls. And I also had to look at what was the trauma that was associated with it. So when I started diving into this, I started looking at, well, what is the box of health that we as Black and indigenous souls are in? And I started looking at institution. So looking at the institution, I came to 3 areas that we'll start the discussion with. That I'd like to get the feedback from you two, and then we could speak a little bit more about this. But when it comes to an institutional health perspective, for this discussion, I figured that we can discuss 1 or 3 of the following factors that contribute to our institutional health and the institutional health disparity. The first one's stress. The second one's environment. And the third one is accessibility. So I'd like to hear from all of us on this. I'm going to give some examples. So Ivy, do you have a comment?
A question up front, please.
Mm-hmm.
Please define for me how you are using the word institutional.
Oh, okay. Thank you. So how I'm using institutional, I'm looking at that as the parameters or the modes or modules, vehicle that is available, or I'll say the vehicle that we as Black and indigenous souls are in relation to health. So that could be our healthcare system, how we're taking care of ourselves. I'm looking at it more from along that line.
So institutional and box are interchangeable.
Yeah, it's interchangeable. And also what's interchangeable with that too, Ivy, is a condition.
Yes.
What are the conditioning? Because, and to give an example, like my conditioning is, oh, I have high blood pressure, I'm going to go to the doctor for meds.
Yep. Okay.
I have this, I'm going to go to the doctor for this. I'm relying on this for this. So my thought is that within those conditions, boxes, institutions, your thoughts on how things like stress, environment, accessibility contribute to our current situation. I'll give an example here. So from my perspective, the stress within the institutional health model that we have is killing us. And what I mean by that is there's a stressor around getting health care. There's a stressor around finances to have health care. There's also a stressor or the stresses around the mental and traumatic experiences within the Black and indigenous communities. I see stress as one of the factors that I think as a collective, as a village, as a people, we understand that the stress is there, yet at the same time, it's brushed under the rug. Like, you know, I'm stressed as hell. Well, it is what it is. Or that's just how it's supposed to be. So I see that right now from an institutional health perspective. I see that as really one of the ways that's contributing to our current scenario. And when I say current scenario, I'm talking about our broken down immune system. I'm talking about our rate of obesity, our rate of diabetes, heart disease, the rate of deaths that we're experiencing, mental health situations. I'm talking about in those scenarios, and that's my thoughts on that so far.
Well, at this point, I would only add one thing to the list, which is topmost for me, is trust of my care providers. When I move, like I said, when I first moved here, and I've been here for a while, I had to really search for people to go to that I feel comfortable with and know would be reliable. I mean, like I sort of watched my grandfather in, a retirement facility, end of life facility, and there's a range of practitioners. And if you get a hateful person, it can make that time period very painful and uncomfortable. I've seen YouTube videos where first EMTs have been called out for inflicting unnecessary pain on the person that they're there to help. And the list kind of goes on. So I guess in a sense, there's there's threat assessment across the board with regard to approaching a Euro-American. But when I'm helpless on the side of the road and I look up in this dude's eyes, it's like, oh, fuck, excuse my French. Yeah. So I have a lot of concern about that.
So Ivy, I'm curious, like with the trust factor, you saying, what I'm hearing is like the trust is one of the things that contributes to our current situation as far as like being able to have health providers that we can trust that's there for our highest good.
That's it for me. Yes. I think that's it for me. And I don't know if it's lurking in the back of other people's mind, but like you say, don't make any assumptions. Not all healthcare providers will operate to the highest good. Their religions or beliefs do. Well, it's obvious their religions and beliefs come into it, in the sense of how at the national level they're trying to control, other people's health options.
Thank you for that, and thank you for clearing that up for me too, because I see that. You bring up a great point, because I see. Even from like working in the pharmaceutical industry for several years, doctors can make choices based on what's the preferred drug of choice, or what's like the endorsement, or what are these things. So really the medication may not be there may be other medications that are more suitable. However, if the doctor is in alignment with what's going to get them kickbacks or what's going to be for the metrics, then that's going to create distrust in the community. Yeah, thank you for that, man.
I have an antidote. I got to meet a healthcare provider for the first time. A young, slim, I don't even remember his hair, but like blonde, blue-eyed type of guy. And I was like, okay, so this is who they put me with. And I'm going through the situation, and it just sort of struck me, like without skipping a beat, he says, oh, just start using shea butter. I'm like, how do you even know about that? So that was one of the things that made me feel comfortable with them right off the bat, because you just seem to have an expanded awareness. Instead of telling you to go buy an ointment at a store, he brought up shea butter specifically, which I believe is more compatible with dark skin. So yeah.
So you have more of a trust with that person.
Yeah.
Then.
It's an African product, so it's for African skin. And so he just, instead of putting me onto all the stuff over the counter, he just says, start using shea butter.
I'm going to come back to that example in a few. Thank you for that, Ivy. Thank you. Mary, I'm going to bring that screen back up. What is it for you that out of these three, or Ivy had another option as well, what is it that you see from the institutional health perspective is contributing to our current situation in regards to health?
The one that stood out most to me was accessibility. And for me, it was for two reasons. One is that we have constructed so many things that make our healthcare system the way it is. We chose our policies. We chose to offer things in a certain way. And other countries, other providers have chosen to do things differently. And so accessibility is a choice, and we've chosen not to make healthcare accessible equally for everyone. And so that was one of the things that stood out most to me. And it links to what you said about the stress of being able to find a healthcare provider that you can trust, to have enough transparency that you understand that they will tell you about something like, shea butter, and respect that there are different culturally appropriate products for different people. And I think that's one of the things that is the strongest factor for me. Also, I think when it comes to stress, it's also just having a toolkit that includes a medical provider, includes mental health professionals, but it also includes things that you can do on your own on a daily basis, and having those things proffered to you freely, and having it be something that you're given knowledge of from an early age, because I think stress is one of the things that we know so little about, but it affects every aspect of our lives. And so it would be accessibility and then stress.
Thank you for that. You hit on several things. Because, and one of the things, the first thing that really stuck out for me is when you talked about those daily practices and the toolkit. Really, the toolkit was the first thing, because I see that as something, as a people, we have yet to learn effectively what are the stress management techniques that are helpful and essential for us. Because, like, for example, I'm teaching yoga and meditation. Most people are like, I can't meditate. They're like, can you sit and watch something while you breathe? Do you breathe while you watch TV? Of course, you're meditating. Welcome. I think there's like this piece for us as a people where we come away from, or we have there's unawareness of what are the things that we can do that are easily accessible to us to help with our health and well-being. And like when you mentioned the daily practices, like what are some things like you see that could be included in
that? Well, one thing would be knowing about meditation, because, I feel like for me, researching a business, one of the things that came up that some of the most privileged business owners, some of the names that you could just recall immediately, they meditate, and it's part of their productivity. So, but this is something that's free that people could be learning about, that you could learn about, from 5 if you wanted to. And I also think that this is an accessibility thing as well, but being able to have access to nature, being able to walk, this is meditation as well. It's a reset, and it's unjust for people not to be able to walk without being disturbed, not being able to go for a run like Ahmaud Arbery without being held in suspicion. We're violating someone's rights, in order, their rights to meditate, to nourish themselves mentally and physically. And so I think a few things that I would include for, it is self-care, but I don't want to be cliche about it. But meditation, certainly, prayer for people who pray, walking. I would also include food preparation. I think one of the things, certainly our families teach us how to prepare food, but we don't get a lot of exposure to why certain foods are good for us, where our food comes from, the cultural origins of food, and how it serves as the first medicine. So I would like to have more exposure to that as well.
Thank you for that. Thank you. You hit on many good points there. Ivy, so I'm curious, I think you're on mute.
I unmuted myself because I wanted to just naturally flow with what I just heard.
Yes.
There's 3 things, so bear with me. 2 of them are short. Vermont is like the whitest state in the nation, but I do travel, and I have offered for free my services the way you were speaking, Mary, for a long time. But what I've noticed is that people of color shy away. And I think a lot of that is really conditioning. And whereas it's easy to find a Euro-American that's eager to learn because they've been given permission. And I think in a great extent, I mean, seriously, they've been given permission because I think in a great extent, when you commented on learning from a young age, my mother tried to sidetrack me. We had a conversation about that because of conditioning in the church, demonizing of different things that goes back, hundreds of years in terms of what is natural. And that includes demonizing Native American traditions, demonizing pagan traditions, as well as African traditions. So I think what I'm seeing today, and it's like a whole generation that is taught to avoid that, for it's of the devil, it's not right, and go for the white approved approaches, while the Euro-Americans are busily gobbling up the traditions from other cultures and turning it into money-making recreation, and it just sort of drives me up a wall. So reclaiming that piece, especially if our elders, if you still have access to grandparents, great-grandparents, to ask them about the good old days and how things were done, because that is definitely there. And I know a lot of work has been done in the Native American community intentionally to get in touch with the grandfathers and grandmothers and rebuild and the foundation of that mental health situation. And with that said, I was going to start out here, but I was segueing off of that. And one thing, I want permission to bring into the circle, because I don't do without people's permission. This is a black kyanite feather. I don't know how it appears to you. I work a lot with natural healing crystals and so forth. And this has several situations. Can you see it, Paul? Or
I can see it. It looks like a harder substance, like almost like a crystal.
It is, feather. It's black kyanite. Okay. It's a feather. It's shaped like a feather and has the markings of a feather.
Gotcha. Yeah, I like that. That's cool.
Yeah. And
what's the symbolism of that?
Basically, it is the system chakra balancing. It's extremely grounding, and it also facilitates communication, which are the three I'll bring into this particular circle, because it does other things, but that needs to be assessed personally. So for grounding, calming, grounding, communication, and energy alignment, and so forth. So I guess what I'm getting at is that a lot of these things are available. And what I might be seeing is, because of the events of the last year or 2 years, people of color now being curious about it and being open to it and wanting to talk about it. Whereas when I was...
So there's more of an opening.
Because there's a need, as it was said, there's a real need for that type of grounding and so forth. And the same thing goes around food. It was sort of interesting. I should have thought about that. But one of the things, here it is, I think. What you were taught to shy away from, and I think that's what you're getting at. The information is there. Wicca in the kitchen. How do you bring about ritual preparation of food, harvesting of rocks? The information is there, but it's also put out by people looking to make money. Whereas in the communities I've been in, I've had the pleasure, the honor of working with grandmothers and grandfathers that will pass the information down orally and more completely and more in alignment with me than what I'm going to get from a book like this. So my sister-in-law gave it to me. I says, "Oh, sweet, that's really great, thank you," and proceeded to put it on a shelf and not read it.
Pick it up and read it, man. Yeah, listen. Well, this comes back to, and I appreciate what you're talking about here. I want to come back to this conversation, and now I want to check. But before I do that, Corky, if you could take yourself off mute, if you could introduce yourself, your name, where you're calling in from, and what interests you about the topic of health today?
Hey, good afternoon, everyone. I'm Corky Wicks, and I'm here in good old Mississippi. And when I looked at the topics, I was certainly piqued my interest in terms of looking at the healthcare disparities. And I've been specifically trying to focus in on youth health as it relates to diabetes prevention, and also with the idea that, especially for minority communities, and trying to get to a point to where we somewhat take control of our own health, due primarily to increasing activity, being more conscientious about the food intake, and just in that particular area, and particularly trying to find, I guess you'd say, evidence-based studies, and trying to work with local medical entities in terms of putting together grants and kind of structured studies from that standpoint, either from an academic standpoint, and with a particular emphasis on how, I guess, say, wearables might help, especially again in the minority community, but then in communities in general, that everybody has on, an iPad or an iWatch or a Fitbit or something. We're tracking all those things, but then what are we really doing with that statistic? So part of my goal is to try to bridge that gap into what we're currently tracking, and then build some type of study that can then act as a prescriptive type of solution to say, okay, we need this amount of exercise, we need to introduce these things into our diet from the standpoint of something that people can do every day, and again, building on what we're already doing and tracking.
Blessings, man. Blessings. I'm
Thanks,
happy, man. Cork, I'm so happy you're here. So I want to give you a rundown of who else is in the room. Mary's here from the San Francisco Bay Area, from the West Side, and I think that if you two can connect in the chat, because she's coming in with that intention about really addressing diabetes and what that looks like in the community and remedies. And I think you two will be a great connection to make with each other. So if you guys can make sure that you guys connect in the chat, that would be spectacular. And also, Corky, we have Ivy coming in from Vermont, and I'm coming in from Summit, New Jersey. So welcome, welcome, welcome. I want to catch you up on where the conversation is right now. And we just went over, I don't know if you're able to see the screen, but what we did was we went over our slide about the institutional health situation that the Black and Indigenous people or souls are in. And we talked about, from the institutional perspective, Corky, it's like it could be conditioning, it could be the box of health that we live in, stories around health. And we each discussed what we thought are the major contributors to our current state of where our health is. And we had 3 selections here. And if you have another one, like Ivy had trust that he added in. So we have 3 selections of stress, environment, and accessibility that may contribute to the situation we're in. So I'm interested to know your thoughts on if any of these 3 resonate, or if there's something else that you see or experience that's contributing to where we are currently in our health disparity and health situation.
Those are actually some good ones. I guess one of the things that I always look at is education, in the sense of what things we feel as if are outside of our control. I mean, we talk about accessibility, and I do a lot of kind of experimental farming, and to where you have the ability really on your back porch or wherever you have sunlight and access to water to start up, an herb garden, or to some extent, growing your food. You certainly wouldn't grow enough to sustain you, but those are some ways you can kind of take your outcomes into your own hands. And so looking at those types of things in terms of community farming, and and I guess in general, education, and that, and again, may be covered in a lot of the areas that you guys are talking about, but I think a lot of that has to do with, we talk a lot about the things that we don't have, but I'm a big proponent of kind of community-based development, and specifically, I look at Ron Gardner and what he's doing out in California, and being able to kind of take charge of what you do have, and not necessarily complaining about what you don't. I mean, in terms of access, it's hard for, I guess, looking at it from the perspective of a grocery chain coming into a neighborhood to where we know that they should be there, but then I guess if you look at it from a business side, is it fruitful for them to be there? And so we got to look at how can we change that narrative and somewhat supply, I guess, our own. Again, I think it starts with each citizen kind of empowering themselves to say, okay, I can't entice a Kroger to come into the neighborhood, but if one person or two people have transportation in the neighborhood and they recognize that there's a difference, then one of the things that I think made Black communities so strong in the past is that they would see that need, and either your neighbors would be growing something or sharing something. We were doing a documentary a while back, and one of the people we were interviewing was saying that, when they would kill a hog in the community, that everybody would get a piece. And so how do you get back to that type of cooperation in terms of, here are the things that, we can't control what an outside entity does, but here are some of the things that we can do in terms of saying, hey, again, if somebody knows somebody outside of the community that has access to even things like watermelons, and you look at how when back, I guess in the 60s or whatever, that people from Chicago would come down to Mississippi and buy, whole truckloads of watermelons, so to the extent that the car was bumping, the ground heading back to Chicago. But they take those watermelons back to Chicago, take them to those neighborhoods, and sell out within minutes. And so those were the types of things that, from a sustainability standpoint, we found a way. And again, it's no excuse to say that those things are not accessible to the community, but then kind of what are you going to do about it? And are there some creative ways that we can find around those things, again, instead of trying to wait for a big box store or something to come to the neighborhood, when it may not necessarily be financially feasible for them, but for the hustler out there, I guess you could say that you could find a way to turn a little profit to where it makes sense for you to go in and bring in produce from the outside and give access to that community.
Man, Cork, you said a lot of powerful things in that, man. So some of the things, yeah, you're welcome. So a couple of things, and this is recorded also, and at the end, we're all going to decide if we want to release this. But I'd like to share the full recording with you, Corky, because some of what Mary said included what she said, and also some of what Ivy and I said included as well. And I think it's really to get specific about the community piece. And Mary, I was seeing that really tying into the toolkit, the stress toolkit you were talking about, as far as what's the sustainability look like? What does community look like? What does it mean to bring our outcome into our own hands? And this is a piece where I'm really excited that we have these conversations and we start bringing these vibrations to existence, because these types of things are what, as a community, as a village, Black and Indigenous people, we're doing. And Corky, I like what you said in regards to what are the ways that we get back to that? What are the ways that we cooperate? And as you said that, Corky, I was like, damn, what are the ways that we do, like the co-op? What's our health co-op? What's our, we're not talking economics here, but like, what are those co-ops? What are those things that we do where we work together, where we heal ourselves, which is also healing community. And this is something Esty Ivy and I were touching on before, that I want us to dive a little bit more into.